Welcome back to the Faculty Factory podcast. I'm Kim Skarupski here at Hopkins, and I'm looking at my lovely colleague, Dr. Maria Trent. Hi, Maria.
Good morning. How are you doing?
Good. Well, folks, Dr. Maria Trent is not only our Professor of Pediatrics and a Bloomberg Professor of American Health, Pediatrics, and Nursing in the Bloomberg School of Public Health. She's also our Senior Associate Dean of Diversity and Inclusive Excellence. And she's the Director of the Division of Adolescent Young Adult Medicine here at Hopkins. And she's an Adolescent Health T32 Training Director. So all that, lots of alphabet soup after Dr. Trent's name. Yale, Harvard, UNC Chapel Hill, Hopkins. She's done it all. We were just spent some time talking about athletes, and her daughter is a volleyball player in North Carolina. And so we were talking about a lot of things in our cultural backgrounds, our identities. And we thought we'd have a conversation around how diversity and an inclusive mindset advances science. And we're going to let Maria talk about what she was, we've been chatting about cognitive diversity as a no-braining head start in science. And Maria, why don't you take it off here and take it off from here and tell us about how you think about the diversity and the framework and the lens really builds and grows our science.
Sure. Well, I think the first thing I'll say is that I think there's a lot of data that we can draw from in order to really unpack this notion of diversity and inclusion and how people participate in our society. The United States, whether people are formally credited for their work or not, there are people from diverse backgrounds who have contributed to the advancement of our society. And oftentimes we hear about it really retrospectively, not necessarily in the presence. And I think we have found it to be very powerful and understanding how those individuals have shaped science and innovation. I think that one of the most popularized stories, and I think about kids because we talk about this, young people really have loved this story. I touched my son. He was like, I want to be a mathematician after watching the movie. And we read part of the book together of Hidden Figures. And he presented on one of the mathematicians for one of the presentations he had at school. And there's just really this notion. I really think that, that story is really one about how you create a professional environment that begins to include people and allow them to take advantage of their gifts very thoughtfully and their training very thoughtfully, so that we can advance science and discovery, which are intrinsic really to our mission here at Hopkins. We have big goals and a big vision for what we want to do here in terms of how we're going to shape human health through both clinical care and in both through science, but also in who we train and how we train people to serve the next generation of patients. And as a pediatrician, I'm very cognizant that the next generation of our patients are going to be very diverse. We'll have in 2050, we'll have the most diverse cohort of pediatric patients than we've ever seen in the United States. And so preparing people to be in that workforce, I think, is also a part of what we envision here for our work. So I think that this notion, I think we talked about, how diversity fits in. There are lots of different types of diversity. I just have to say that, first of all, we think a lot about discipline diversity when we work on teams, for example, in the hospital. We talked about really how patients benefit when the team that comes to see them in the morning. So we have these interdisciplinary rounds where the physician is there, the nurse is there, but maybe the pharmacist is there, the trainees are there, maybe a consultant. So they might say, I need adolescent medicine to come, and we're going to talk about one of your patients at 9:30. Could you come on to rounds with us? And so I'm there, our fellow is there. Social work is there. We're all there together. And I think for a patient who really has significant health needs and perhaps social needs, and there's this complexity between the two, when we're all there together with the patient, especially if their family is there with them, and we're all working together for that patient, the outcome is consistently so much better. And so there's that level of discipline diversity, first of all, that we have to have in healthcare and that we have to have in research. I have a research team. I've been working with the same team for over a decade, maybe longer. We're all very different. In many ways, from a discipline perspective, there are people who are on the team who, they're scientists. So I'm a clinician scientist, which means I design studies that really are related to optimizing patient outcomes through randomized controlled trials or clinical trials, behavioral trials, in which we try to tweak something in how we're delivering care in order to try to make the outcomes consistently better for the whole. And but on that team, I'm there, but I do nursing research, and so there are nursing people on the team who really innovate how we're delivering services in the community. We have outreach workers, so people who know how to talk to people, who can find people in a tough city. We have people who are adept at just talking to people and explaining the study to them. I have to say, our School of Nursing students are amazing at that. We have some hired research assistants that are on our staff regularly, but I have worked with School of Nursing students who have been research assistants with me for again over a decade. And we have bench scientists. So then I try to innovate this notion of what novel can we bring into our clinical science. So there's a whole team over at the Johns Hopkins STD laboratory and that works with our team. They are bench scientists. And so we are taking new scientific discovery and we're trying to put it into the field to optimize people's outcomes. And so that's a lot of professional discipline and cognitive diversity. But there is also substantial gender, sexual orientation, and racial ethnic diversity on our team. And we actually wrote about what made our team so special, because someone said, I can't believe you have that kind of retention rate in this study. I went to the CDC and I presented today. They're like, I can't believe you have this kind of retention in teenagers, in urban community, for young people who are often living on the fringes. How are you able to keep these people in the study? And there are two reasons. Okay, one is this diversity of skill sets and understanding of the community and life experience and style and how you manage people and each other that we bring to the table. But the other piece of it really is we align on one thing, whatever it takes. And that became, when we were talking about it, you say, whatever it takes, we follow our protocol, but to the best of our ability, we do whatever it takes to make that protocol work for them in a place like Baltimore. And that means we have to design the study for them. So I need people who understand the neighborhood, the community, the safety factors. How can we execute this in real world? So our project lead manager, he understands who to hire, what are the right people that will work on this team. He lets me know if something happens. We kept this team together during COVID. We would meet every week. Even if we didn't have one new patient that week, we would still meet. We would talk about what was happening, what we could be doing otherwise. So I think it's really that diversity of people that has made this work for us. But it requires that you see people beyond, sometimes I think, what you see on the resume. And I think that from a leadership perspective, you have to think about what the attributes that a person brings to the table are, so that and whether or not they map on to the work that you want to do. Marie. There's also a ton of research on this notion of cognitive diversity. So we can all agree, you want people who are well-trained and have evidence of that. Their CV looks good or their transcript looks great. They wrote a great personal essay if it's a trainee. You want all that stuff, but sometimes people who look good on paper, there are other questions I ask people, like, what are you working on right now? Or tell me about a time that was difficult for you and how you handled it. I listened to someone the other day tell the story about a job interview where they were talking to two people. And he said that there was this person who came and said, oh yeah, I took a class on that and here's your answer right here. And then the second person didn't know the answer, but said, let me take a moment. And that person went out and did research in real time to find out what what the answer was. And they came in with the approximate answer that was similar to the person that who just sat in the classroom. And they said, well, who do you want? Do you want the person who just pulled that out of their head? Or do you want the person who knows how to think out of the box, the person who went out and got that additional information? And oftentimes those are people who have grit, who have resilience because they have faced other life experiences. And so as that lived life experience is a form of cognitive diversity, particularly if you can use your existing cognitive gifts for problem solving. And then you have this extra layer of capacity to think under pressure or to think outside of the box that really shapes, a team to have that kind of person on it. And if you have multiple people like that, it works. The other thing that the data shows us is that psychologically, when we're on teams of people who are just like us, who have the same training or the same background, we expect each other to also fall in line. And we often do. They've talked about this in the employment world about how people oftentimes will only hire people who are just like them. Mm-hmm. So what happens is, when those people, one person on that team of like people does not agree, it devolves into chaos. So the psychological literature suggests that when you have people who are different, people are much more flexible when it comes to hearing other perspectives, and teams are much, they're much better able to really think out of the box together. And what that has resulted in, right? This alternative diversity, in addition to sort of skill set and cognitive function that people bring to the table, is they have more innovative designs. People are able to solve more problems. They make more money, right, from a tech perspective. And it depends on what your value is, but I like to solving more problems. And that really, we're trying to solve more problems while staying afloat. That's part of what, the business of medicine. We're trying to solve these problems in a way that allows us to operate a space that will continue to be here. I have to tell you, though, I really feel, I know there's been some controversies about, trying to figure out who Johns Hopkins, the man was, because there are no real papers left. But what I will say, and I have stood on this even in the midst of a little controversy, is that what he wrote on paper was very clear. In 1873, to write that we have to care for people regardless of race, gender, or ability to pay. In 1873, in the situation that was here in Baltimore, on paper, and that we were supposed to have a specific place in our heart in terms of how we were going to care for children here, particularly those who were vulnerable, orphaned specifically, and for children of color. On paper, that's a part of how I see our responsibility as well, and I find that sometimes people maybe don't do things in life, but expect somebody else to give somebody the resources to try to do it after they're gone away from here. I don't know, but what I will say is I think that that's a powerful statement during a tricky time in American history for someone to say, "I want you to build this thing. And I want you to keep these things in mind." So I think that our charge has always been very clear on that someone understood even then the role of diversity. And that is part of why I think it is a core value here at Johns Hopkins. And then one we have to really cultivate right now in a complex social political context, but that is also still intrinsic to the work that we have to do. So I think we're working hard to try to do that here, to take better care of our patients, to continue to innovate very thoughtfully, to do research that's meaningful, and to train, I think, the best physicians, nurses, pharmacists, interdisciplinary social workers across, in the world here. We have to be prepared to train all of them because they're increasingly diverse. And then we also have to be prepared to have them care for an increasingly diverse population of people.
This is wonderful. It's so amazing. I love the track record and how you've built this, the high retention in your programs, and kudos to you and the team. As an academic, intellectually, we all get this idea of, as you put it rightly so, cognitive diversity. We get it. It makes sense. And yet, what is it about us that when we submit a paper or a grant application and it comes back with the dings and the criticisms, the nature of academic medicine. We're like, oh, they don't get it. Those reviewers, they don't know what they're talking about. Or we get very defensive when we don't appreciate how other people think, that when they poo-pooing our thoughts, or our paper's not good enough, the grant's not good enough, they're not thinking like me. So they're dumb. Something's wrong with them because I clearly have it figured out. And those reviewers don't know my space. They don't know the field. They don't know what they're talking about. Where do you get that humility to kind of slow down and say, let's think about, as you call that, cognitive, let's consider some alternative way of thinking? Where that's to me the paradox, that we work so hard to be specialists in something, and then how dare someone come on and give me something, challenge me on that thought. So how do you help us to humble ourselves to think that, yeah, you are the expert, and there may be alternative ways, or just the mere fact that you got a question signifies that maybe you weren't as clear as you thought you were going to be. Maybe you and I were sharing, you not only diversity in the professional space, but you're a staff person who was an engineer who had this mathematical genius that maybe somebody else wouldn't have recognized. Or when I was in Chicago and we're designing, dietary patterns and menus for people who are like, I don't eat that stuff. I'm not going to spend hours prepping. Do you not know the realities of my world? How do we humble ourselves to even be able to appreciate that?
Sure. I mean, so it's interesting. I think that, for these big grant applications, we spend months working on them, sometimes longer. And you put a lot of personal time and effort beyond your, what we call effort here at work, in order, spending nights and weekends, putting in references. You really are working very hard. It's interesting. I do think sometimes people don't get it. I do think that's true. I think that can happen. I think you can write something that's you're very clairvoyant about, this is why it's important. And I think that it doesn't have the right home. So I think that also can happen. So I think you have to think very critically about who you send your scholarship to, who you're expecting to fund it. You have to also write for that audience. If you're sending it to some place where, maybe they're not interested in clinician scientists who are doing this kind of work, they're really interested in basic science. You wouldn't send your clinical paper to the group that has a track record of reviewing this. So there's that piece. I think that people who try to pave the way, the second thing is I'll say is need ego. It's important. I think humility is not about diminishing yourself so that you lift up others. It's about allowing yourself to still allow your light to shine while you're also appreciating and embracing the contributions or opportunities that can present themselves by engaging feedback from other people. And you have to begin to view that as a gift. Somebody who volunteered, essentially, I think the NIH maybe pays somebody $250 to spend hours reviewing your grant, right? And then to go to meetings and to sit and read them, right? Maybe it's a little more than that now, but basically, to really go over all these grant applications, someone invested time in that. And they were just giving you a perspective. And I think that I give people, depends on how big the grant is. If it's like a super big one, I'll give you 3 or 4 days to be angry, to be devastated and upset. But then I really do ask people, whether it's a paper or a grant, give yourself a few days to be salty, right?
Yeah.
That's how I describe it. But then you really have to, if you're going to stay here, are you going to move the science forward? Or are you going to try to fulfill your personal mission, then you have to regroup. And so I used to tell people, I was like, write the letter first, write the 1-page introduction to the application, which tells, what you're going to do differently. How are you going to respond to those critiques? And I think in responding to those critiques, you have the opportunity to make positive changes to your application. You have the opportunity to make positive changes to your paper that you got back that somebody just didn't get. Well, then write it so they get it. That means that another person, your idea might be on point, but you haven't written it in a way that a reader can understand it or a reader can grasp it. It's interesting because I think that's the other thing that as scientists, we have to work on. And we saw that during COVID-19. We are in the middle of a crisis and people are rejecting, the vaccine, right? Hard to believe, right? That, people are dying all over the world. And yet people are like, That's okay, right? And so I think a part of it for science is really that we have to also be able to articulate our work, like what's going on here, all that innovation and creativity that our team's been insularly working on. And you have to be prepared to explain that to someone else, to both other scientists who may be accessing funding or publishing it, but also to the lay public. And I think that that's a real gift that we always don't process because we're so focused, I think, on the scientific and cognitive, special cognitive skills people have developed, that we haven't focused on their social skills, how this reads to certain communities, and some of that is that other diversity. Because I think, the error that people make too is that cultural, ancestral, and other diversity that people bring to the table is not cognitive diversity. It is. Right. And so that's the mistake people make. But really, it's about people reframing and reshifting. We're all disappointed when things don't go our way, right? Yeah. But we have to have grit here, this kind of institution that we're in. We have to reframe, shift, and then move it forward in a way that's meaningful. For that to happen in a place like here, it's really important. I think, somebody who works in the dean space, for faculty and trainees to really have a developmental network of people that are there to support them. I really believe in developmental network theory, and that's a part of it. You need to have people that are there to support you, to let you vent about how awful those people who reviewed my grant are, right? But then in that group, you have to have the person that listens. That person might not be the same person to say, but hey, wait a minute now. I think they have 3 points here that you got to take a look at, right?
That's it, Maria. I like that part of it, is that I want to underscore what you just said there is, those of us over all of our institutions around the world here, not only do we recognize this importance of cognitive diversity and diversity in its fullest sense, we have to then build the culture that allows that diversity of opinion. So it's one thing to say, we put all these people on my team, but then you have to be able, Kim, I'm talking to myself, shut up and then listen to what everybody else has to say. And as you were giving me example, and maybe think before we recorded, you could design the most perfect study and this most perfect, and any solution or intervention. But if you've not listened to all the voices and the perspectives and the history and the traditions and the wisdom, you may intellectually think that this is what science says. But it's in applied sociology and epidemiology, we talk about nothing about us without us. You go into any city, institution, community, organization and try to put some kind of intervention there. But if it's completely irrelevant to all the factors, it's going to flop. So we have to also have that as investigators and scientists and people who do healthcare. We have to have that, not only the humility, but the sensitivity to invite that conversation. And don't just say, everybody's free to give their opinion here. Ideally, but in reality, people know, she says that, but she doesn't really mean it because she's going to steamroll right over you. So what you've done is you've obviously built an environment people know it's safe to say, I call time out here. That's not going to work. I know that church, or I know that neighborhood. I know that zip code. And let me tell you why. So that is also part of our obligation, that we're not, again, like you said, we're not trained in this stuff. Why we need marketing, communication. We're not trained in these things. So all the more reason why we need people who are there to teach us. We're not the keepers of all truth.
I think that's true. I think what people didn't realize, though, that there were people on the front lines from diverse backgrounds who were making vaccines. That's diversity bonus that I'm talking about. They were making the vaccines, right? At the NIH, right? Then there are people who are working from an epidemiological perspective and on the ground public health perspective in communities. There's some, like Philadelphia had this physician and a group of people that coalesced to transform the vaccine immunization rates in Philadelphia. And we did some of that work here as well. But oftentimes it took people from similar backgrounds who could explain the science to people, who they saw getting the vaccines. I think it takes that kind of understanding of community-based interventions, of how you even take a product and how you market it to people for their own health and their own in a way that they can accept. I think that that's important. But I think when we don't have people who are at the table in all those spaces who can share some representation. Now, representation does not mean that person knows all about everything about that space that they're in. But to some degree, I think it's critically important because they oftentimes, if that's not their perspective or experience, they have access to it in a way that other people might not. And so I think that that's the challenge in these nuanced situations is that I do think that we also have to be careful at work, though. I don't know that every opinion is professional. And I think that people have to understand how their personal views and how their professional expectations line up. We do have some boundaries here at Hopkins as it relates to how you work with your colleagues, how you talk to your colleagues, how we interact with trainees. That really has to be above board, that are collegial, are respectful, and are thoughtful. And not all perspectives are that way. And so there are oftentimes that people have to bring their best professional self to work. I've also been a cultural competency trainer for now over 20 years. And the thing that I learned is that allowing people sometimes the space at work, even to unpack that stuff that they've been carrying in a safe place, has been very powerful. I have worked with teams in which individuals really talked about the challenges that they grew up in terms of how, for example, their families thought about people from different backgrounds, and how it just never settled right with them until they finally found a strategy to do that. And that working on this now diverse team has really freed them of that and allowed them to really live a life with the beauty of diversity in it. I remember the person, they cried because it was just this powerful feeling to now be in this space where one could even say that safely and say, this is how my family is. And I've been working against this my whole life, since I was a teenager. I knew it wasn't right. And now I'm free of that. I'm helping populations that need me. And I feel good that I can stand in this space. And then that empowers the team. And the team says, well, doggone, this person has, come out of this space where they are very, unidimensional and thinking about diversity. And look how powerful that is and transformative that is. Yeah. And look how much better that person, makes our team. And it's that kind of transformation, I think, that is important. That because that person then also hears the person that says, well, this is what I face because I'm from this marginalized group. I've managed to overcome most of it, but it's still very painful for me. Sometimes in the workplace or out in the community, these are the things that I experience. And then that person says, and I'm also grateful to be able to share it in this space with you all so that we can work together to help change the lives for our patients. And that kind of team, when you get people who can talk like that, then you can bring your true self to work. Then you can bring your true self to work. And then you also can problem solve together because you know the perspective that person's coming from. And that some of the cognitive work people have to do around managing themselves at work, it begins to fall away. You can focus on the work. And I think so that's like the ultimate goal. That doesn't happen on every team. Sometimes people just bring their best professional self because that's what they can do. And I think that can be a safe place for people. So I think it ranges. You can have this very fluid, interactive team that knows a lot about each other. But then you can also have people who know their gifts and strengths, and they can bring those to the table. They can work very efficiently, very effectively. And that also is a very valuable team, as long as there's mutual respect.
Maria Trent, fabulous. Can I ask you another question? What about our colleagues who are not in a diverse urban population? One of my dear friends is the only African-American woman in this area of Iowa, and she feels it profoundly. What about those of us who maybe live in parts of the country or the world where there's not diversity as we think of it superficially? How do we challenge ourselves if we're in the rural areas, or certainly areas where just many parts of the world where just we don't have that kind of something like 62% African American Baltimore. We don't have that patient population or learner population, and we're not getting patients or learners or people who don't look like me. How do we as scientists purposively challenge the thought framework, and how do we get out of our comfort zones? What can we do? How can you speak to that from our colleagues who are maybe like, oh, it's easier in Baltimore, but I'm in fill in the blank and we don't have that?
Sure. I mean, I haven't always worked here, so I have been in those environments, and sometimes that environment exists here at work. So let's just be clear. I talked about the community diversity. I am a 1.4% of African American professors here at Johns Hopkins, and so I understand how your colleague may feel out in Iowa, sometimes at work. So I have total appreciation for that. So. That's a whole other story. What I will say that I have learned over time are two things. There are wonderful people who may not have my shared ancestry, who can be amazing friends, colleagues, resources, and allies. And if you find those people where you are, and there are people who are willing to do that, I oftentimes think of barometer. Sometimes I would ask people, like in seminars, do you have a friend without your same ancestry who you're such good friends that you would go and spend the weekend with them and you would stay in their home with them and their family, right? And for me, that's a barometer of it. I remember when I was a fellow at Boston Children's and a student at the Harvard School of Public Health, I was one of the few fellows that we had diversity amongst fellows, but like over time. But I can remember the beauty in having one of our senior faculty members say, Maria, and you want to go to church with me on Sunday. And she went to an African American Episcopal church, kind of church my father went to. And I would just go there and I would feel at home. And I wouldn't have found that space probably without her. And so there was somebody at work who wasn't necessarily my supervisor or definitely she's high up in the system. And then she included me in some things that she was doing with some of the psychologists. And that was just really very grounding for me. But I think I also had a really close friend. And I think of her often because she died a couple of years ago. But she just, she was very different from me. And, but she was a source of bright light for me during my training. And we could talk to each other about anything. So for me, I have a really open mindset in terms of how I create my developmental network, and the closest circle to me are the people that you can talk to, who are close. You need those if you're going to just survive an environment that you are trying to achieve in ever. You're going to fail at stuff. You're going to be great at stuff. You need somebody who's going to be a cheerleader, but also somebody who's going to pick you up if you get down. You need those things. And so I think that I have to say that there are wonderful people in a lot of places, especially if people want to be wonderful. And one of the first things she did, Maria, you're your husband. My husband, Greg. He's like, you and Greg want to come out for the weekend? I was like, okay, sure. And they had this fabulous place. And it was amazing. And but I remember I just laughed so much when I sat at the dinner table where she prepared all this food, and we just had such a wonderful time. And it's those kind of people who are just built differently in terms of, I think about a kid in my neighborhood. He's growing up in, our neighborhood is very diverse, but he's one of the few non-kids of color who grew up in this neighborhood. And he's going to be built different. And the data suggests, actually, he's going to be more social, better in the workplace. He's going to be very successful because he knows how to navigate people who are very diverse in a myriad of ways because of how our community has shifted. And I think that it's really beautiful to watch. I mean, his mother also, who's my friend, also models it for him. But I think that it's that kind of environment that we can create even when we are not surrounded by people who have our same ancestry. I don't think that has stopped my commitment to our goals around workforce diversity here at Hopkins, around training diversity and around student diversity. We have made a commitment to that as a community and from the highest levels. And so we still have a lot of work to do in our environment in order to ensure that we can meet those goals. And we are looking for people who are both from those backgrounds, but also people who are built differently, like a kid in my neighborhood, who can talk to anybody, who can think through and solve problems, and who can work alongside people who are different from them. And I think that's essentially, I think, what we're looking for.
Love it. Love it. Open mindset. That's it. To me, always say that my brain is a zombie because my brain, not necessarily want to eat, but I want to eat other brains because my brain is so thirsty for other brains. So how could you not want to be curious about all the brains that sit everywhere in all different shapes and forms? And I like what you're saying, and you're making me think that no matter where we are, we can adopt that open mindset. We can challenge our own brains to stop, and say, well, how else might I think about that? So that's what we do as scientists. We're curious. So just to be more curious. So even if we feel like, well, I can't do that in my fill in the blank division, department, institution, community, neighborhood, state, country, I can't do that here. Can you? Now the web connects all of us. We can go anywhere. And just being open and being curious about what does that brain think about this? Boom. We can't help but advance science if we just kind of like take in all that and open possibilities. So Dr. Maria Trent, you are amazing. Thank you so much for sharing all this wisdom. I'm going to leave the final thoughts about how diversity and an inclusive mindset can advance science.
I think that the most powerful thing to understand is for people, teams, for institutions that have a big vision, that it's important that diversity is a part of it, and that we understand that there are different types of diversity. We highly value traditional markers of achievement here, and we see those and we look for just those things in individuals sometimes to bring diversity. And I think what I'm encouraging people to do is to think out of the box about what cognitive diversity looks like in our environment, and how we can challenge some of those traditional notions in order to have the best workforce, the best research team, the best students, the best trainees here at Hopkins. We're really going to revolutionize clinical medicine, science and technology, and really become the teachers of the future. I'm getting old, so they're going to be the teachers of the future. And so I think that that's a part, if we want to really fulfill our vision and our mission here, that I think we have to stay the course in terms of doing this work.
Dr. Maria Trent here at Hopkins. Thanks for being on the Faculty Factory podcast, and we'll all see you all and talk to you next time.
Hello there, Faculty Factory listeners. It's your podcast producer, Casey, just checking in with a little update here. Just want to let you know that as of November 1st, 2023, this podcast that you're listening to has had nearly 82,000 total downloads and YouTube views from listeners in 94 different countries. And the Faculty Factory website, facultyfactory.org, has drawn nearly 40,000 web visits from users in 122 different countries. This is truly an international platform, and we want to invite you to be a guest on this show. Our host, Dr. Kimberly Skorupski, makes the experience very engaging, relaxing, and she actually makes it fun. As producer, I'll make the edits, so if you need any edits on the back end, there's no pressure for you to nail it. I can simply make those edits after you record. We just want to hear from you. We want to hear from different faculty around the world so we can all learn from each other. Please reach out if you'd like to be a guest or to nominate someone in our academic medicine community that you think we need to hear from. You can visit the Contact Us page on facultyfactory.org to send us a message there, or simply contact Dr. Skorupski directly at kskorupski@jhmi.edu.
Thanks for tuning in to Faculty Factory Podcast. The mission of the Faculty Factory is to build and support a community of leaders in faculty development who share tools, resources, wisdom, and encouragement in service to our faculty members, schools, and institutions. We encourage you to go to facultyfactory.org to find out more, get in touch with me, ask me any questions. Maybe you want to be interviewed on the podcast. Thanks for tuning in to Faculty Factory Podcast. We'll see you next time. The Faculty Factory podcast and website is sponsored by the Johns Hopkins University School of Medicine Office of Faculty. For more information, visit facultyfactory.org.